A 3-year-old boy is brought to the clinic due to left ear pain over the past 3 days. Last week, the patient developed a runny nose and cough, which resolved 2 days prior to the development of ear pain. There is purulent discharge from the left ear. A Otoscopic exam of the left ear reveals an erythematous tympanic membrane with purulent fluid. Which of the following organisms is the most likely cause of this patient's diagnosis? So this patient had the upper respiratory infection, and following the upper respiratory infection, he developed otitis media. So remember that the eustachian tube is going to be this tube that is going to be connecting the nasal cavity over here to the middle ear. Now, when he developed the upper respiratory infection, that is going to result in inflammation, and remember that inflammation is going to lead to vascular permeability, and with vascular permeability, we're going to have leakage of fluid into places. So now we have this inflammation and leakage of fluid that is going to be blocking the eustachian tube. One of the functions of the eustachian tube is going to be to stabilize the pressure between the ears and the atmosphere, and the other function is going to be to drain secretions coming from the ear. So if we have secretions coming from the ear, because of this blockage, these secretions are not going to be able to be drained. As a result, we're going to have a buildup of these secretions. And so anytime a tube is blocked, we're going to create this rich environment for bacterial growth. And the important thing to know is that the most common bacteria that is going to grow over here is going to be Strep pneumo. So Strep pneumo is going to be one of the most common causes of otitis media. Now, as you can see from this picture, we have this purulent fluid that has built up, and this purulent fluid is then going to put a pressure on the tympanic membrane. So when we look at the person's ear through otoscopy, we're going to see this bulging tympanic membrane because this purulent fluid that has built up is going to be pushing on that tympanic membrane. Now, in the question stem, it said that we also saw drainage of fluid of purulent fluid from the patient's ear. So that means that this purulent fluid has put so much pressure on the tympanic membrane that it resulted in perforation of the otitis media. So we actually have this purulent fluid draining out of the ear. So otitis media is going to be different than otitis externa in that with otitis externa, we only get infection of the outer ear. So because of this, the tympanic membrane is going to appear normal on otoscopy. And one of the most common causes of otitis externa is going to be Pseudomonas. We can also get it as a result of Staph aureus infections as well. And we're also going to experience ear discharge because of this infection that is only impacting the outer ear. Remember that the tympanic membrane is going to be normal. So that is how we can differentiate otitis externa versus otitis media. With otitis externa, we only have infection of the outer ear, so the tympanic membrane is going to be normal. Whereas with otitis media, remember that we have this purulent fluid that has been built up behind the tympanic membrane, and so that purulent fluid can put a pressure on the tympanic membrane, causing inflammation and causing the tympanic membrane to bulge outwards, which we can see on otoscopy. So to answer the question, the answer choice is going to be Strep pneumo, which is going to be answer choice D.